All right, right now we're going to take a look at the facet joint syndrome. So, Dr. Walsh, what is a facet joint? Good question. Facet joints are, you have 6 joints per vertebral level, okay? You have 2 on the vertebral body, 1, 2. Then you have 4 posterior. You have 2 above and 2 below. So here, this is 1 above. There's 1 on the other side because this patient is facing this way. And then here's the other joint on the lower, on the left and right. So there are 4 posterior joints. This one, you only get to see 2 of them, and they are on the left side. How do I know that? Because the patient is facing this way. This is vertebral body. This is posterior element. And the upper one on L4, left side, is inflamed. Now, facet joint, that kind of syndrome, that kind of covers a vast difference, and this is what I mean. As far as it says irritated facet, okay, there's a lot of ways a facet joint. Now, facet, just think of that as a joint, a name for a joint, like a knee joint, a shoulder joint. A facet joint is a specific joint on the posterior elements, and it's irritated. It's inflamed. Okay, now, with this, you have ligaments that are holding bone to bone there. Is that what's inflamed? You have muscles that help move those joints, right? So you have tendons in that area. Are those inflamed? Or is the bone itself inflamed? Okay, there's differences. The difference is the bone inflammation, if it's gone on long enough, you start to get arthritic changes. The other soft tissue inflammation can be helped basically by taking that tension off, right? To reduce the inflammation. So you've got to figure out, okay, why is this thing inflamed? Is it that I'm doing repetitive motion or something too long and the tissues just can't do it? So that would be considered maybe a weakness in those tissues. So what do? You give them a little time to heal, and then you start to do exercises to work on their strength, okay? Slowly bringing it up. There's always a nutrient factor within it. That's why diet's very important. Okay, so the bone, okay. Now, we discussed Wolff's Law in other videos. Wolff's Law says when bone sees more force, it lays down more bone. In joints, that could be arthritis, okay? So, are they in a bad position, whether their posture or their job duty cycle puts them in a bad position? Repetitively, over time, starts to irritate the bone. So if that's it, then we got to analyze that, right? And then we got to make changes to that. And it might be just strengthening up the tissue around it to not allow that joint position to be there too long, okay? Either way, there's got to be rest. Depending upon the amount of inflammation, the length of the inflammation, and what's been done about it is going to dictate the treatment for it. And actually, we may need x-rays and or MRIs to see the extent of the damage. So that is your facet joint syndrome.